Have you ever thought of how the Medicare freeze can affect you? Let's talk about Medicare. Medicare is a public health insurance scheme in Australia. Medicare rebates are support payments from the government. When you access eligible health services, there are two ways Medicare rebates can be reclaimed. The first option, where the patient pays and the doctor claims the rest from the government. Bulk billing is where the patient pays nothing. And the second option is non-bulk billing, where patients pay the full cost up front and then claim this rebates from the government. Healthcare costs have increased by 74% in the past decade. The government felt such expenditure on healthcare was not sustainable. So, the government decided to freeze the amount of rebate from 2014 to 2018, then further extended it to 2020. It is estimated that this will help the government save $2.8 billion. But, while the government is saving money short term, doctors and patients are forced to cover the increased healthcare costs. Let's look at it this way. The government is currently paying about half a typical GP consultation fee. However, because of the Medicare freeze, the government will pay only a fixed amount over these coming years, which means you, the patient, will be paying more to cover increasing health costs. Let me tell you how Medicare freeze can affect someone. This is John, and he needs to go to the doctor every fortnight despite being on a low-income job. John tries to make it to the doctor by saving money. He starts to work more, becomes tired and sick. Unfortunately, John starts to buy cheaper food to save on costs and develops high blood pressure and diabetes. He stops hanging out with his buddies and they lose touch with him. He becomes depressed, loses his job, and cannot afford to pay his rent anymore. Medicare freeze impacted John in every aspect of his life. Unfortunately, there's not just one John, but hundreds and thousands of people who are in similar situations. These include the elderly, people with low socioeconomic status, people with chronic diseases or comorbidities. Medicare freeze violates the human rights to equity in healthcare. Article 12 of the International Covenant of Economic, Social and Cultural Rights state that it is the right for everyone to enjoy the highest attainable standard of physical and mental health. This means that everyone has equal rights to access the best available healthcare. The Australian healthcare system is the main social structure as it governs the Medicare rebate policy. We are advocating to fellow Australians to join hands in influencing Medicare rebate policy. Click on our link below to access our video and share this on other social media websites. Don't forget to hashtag Unfreeze Medicare to increase awareness on this issue. As local Australian citizens, we hope our actions will lead the government to change the policy on Medicare. To do your part, watch and share our Unfreeze Medicare video, sign the petition and join in the campaign today.